Hey guys, good to see you all again. Dr. Sandal here. So we had a great success with the last Ren reaction video, really digging the Ren crew. Thank you guys, all the renegades, for all the love and support. So my social media manager definitely was right. You know, the Ren talks about all this stuff that is so much on point with what we're doing all the time. The medical system really does need to be restructured, and I love to see artists who are really leaning into that, who are really using their art form to help make that clearer to people. I think everyone kind of understands that, like in the abstract, but then to see someone go through that journey, I think just hits a little different. This is the sort of stuff that I work with patients and try to empower patients through literally every day. It's my passion. It's the thing that gets me pumped up. When I see patients who have been abused by the system come and heal and feel whole and empowered, I mean, I get pumped. So we're gonna do another Ren reaction video. I haven't seen this one. I'm pretty keen to check it out, and I'll kind of pause and ad-lib as we go along a little bit. This is Ren Troubles. Yeah, I'm looking forward to seeing how he describes this, because this is actually not a terribly uncommon scenario. You know, we live in such a sterilized culture. People who are ill are somewhere else. But the reality is that a lot of people go through some degree of this. And yeah, it's a huge morale battle, because you see the people who are supposed to be taking care of you and paying attention to you. And if they dismiss you, and if they kind of stay in their very narrow lane and go, well, you know, nothing's wrong with you. Oh, it's so frustrating. And that's common because we live in an era of hyper-specialization in medicine. And there's a sort of justified reason for that. Like, medicine is very complicated, so people think, oh, well, why don't we manage that by all picking a lane and getting really good at that singular lane? But the huge problem with that is that we only see the lanes as they're defined. We don't see all the spaces that are in between those lanes, and there's a ton of that. So there's a lot of people with a story similar to that, and it's just miserable. Yeah. All right, let's check this out.
I've been reaching to the past very much for these shards of shattered glass and harsh paper cuts. Leave me stop when I reach in, memories are seeping. Hydrochloric acid, I go to war and get passive and freeze up. Music helped the ice to thaw. Put the chisel in the middle, swing the hammer of Thor. Pull it out of the impossible, Excalibur sword. Etching notepads full of reasons why my feelings are sore. The first day that I got sick, ejected from the cockpit of living. 19, young teen, waking up bitter. Posters up, manhunt, Ren went missing. Hard to have faith when the gods don't listen. The first hit maybe was the hardest. Waking in a body that was buried like a carcass. Brain in the lion's den, body in the shark pit. Waking up in pain again, aching, broken hearted. Persistent little blogger, I was bouncing from a doctor to a doctor to a doctor, like a table tennis game that has no end. So be the fate.
I just want to say really quick that his flow and his diction are just awesome. Just love that. The Excalibur line, it's freaking sweet.
A doctor to a doctor to a doctor, like a table tennis game that has no end. So read the fate of Ren. Every single question answered with a question on the end. The second year I came to terms with giving up my dreams. Mine was severed from the means that helped me write these rhyme schemes. Brain was inflamed, the fatigue was crushing. Hard to remain sane with your brain combusting. And the third year was murder, living in a purgatory full of worry. Wouldn't live to be 30. Lifestyle hurt me, always in my bed to rearrange the alphabet and all the letters spelled doom. Light hurt my eyes, popping pills to survive. When you're 23 and mentally you steadily decline. 24 I was poor, disability benefits. What's the benefit? benefit of this ability. It's irrelevant. 25 and the scars that were etched, they crack. Elastic bands only stretch so far and then snap. Deep in psychosis, hallucinations, troubled vision. Visits from the underworld were conjuring my superstition. 25.
So the process of illness is something that is so I'm going to say metaphysical. It is so much more than just the physicality. There's so much more that is involved in that, and I love that he's again using poetry to describe that process in a way that hopefully people can kind of connect with, even if they haven't had that experience themselves. One of the most frustrating things that I hear is that patients go to doctors and the doctors have a very strict thing that they focus on, and if patients don't follow in that and they're not in that category, then the doctors go, well, you're fine. And what happens is you get a sort of string of diagnoses, and he says, questions about questions. And it's like nobody is actually taking ownership of this issue. Doctors rarely take ownership and responsibility for their patients. In fact, part of the real struggle of our system is that doctors are, so much is demanded of them because of the failures of the system. Now, I don't exonerate doctors for that. They should fight against that. It's not like they're faultless in this at all. But doctors unconsciously and sometimes consciously through their training develop these sort of emotional shielding techniques where they don't take responsibility for the patient. They don't see them as a person, because the doctors end up having to see patients in like 5 minutes, and you can't do good work for an individual in that period. It doesn't happen. And so the doctors, they go through their own really excruciating burnout and sort of muting or dumbing down of their empathy. And it's horrible that our system is designed like this. Like residency training for MDs and DOs is just, it's just a grinder. And all of this is a system issue, and yes, the MD should be pushing back and saying like, listen guys, we can't do good work in these circumstances, give us some space because I need to see my patient as a human being who needs my help, right? Really, if people ask me to define a physician, it's a scientist, healer, and there's just not enough of that right now. Okay, back to the music.
Hallucinations, troubled vision, visits from the underworld were conjuring my superstition. 25, living back at home with my mom, but not because I'm a bum, alone and physically done. So thin, so frail, so weak I'd become, and my skin so pale, never kissed by the sun. One time I carved a hole in my chest just to feel. I wish that was a metaphor, the struggle was real. When you're living in the Holocaust, you buckle and kneel. There's relief in the teeth of the kiss of cold steel. Facts. 26, I'm highly medicated and the pain sophisticated while I'm lying broken naked on my back. Have on my microphone until my coffin started dropping raw thoughts with the grim reaper knocking on the track. But then man, lo and behold, I heard an angel beckon on this treacherous road. Was a stem cell doctor with a generous glow. In the cell transplant pulled me out of the cold, and my skin got younger and my body got stronger, and my stomach felt hunger for a door that was closed. And my soul heard music for the first time. Beauty was a word I'd use for this gift of gold. Oh Lord, I...
Complicated illness requires outside the box thinking. Like that's just the reality of it. If people go to doctors and doctors aren't giving them answers, they need to go to doctors who are more that physician that I talked about, that scientist, healer. People are going to think outside the box, think about you as an individual. And he's talking here about the use of stem cells to get over stuff. And of course, there's a lot of different varieties of stem cells. There's a lot of technicalities. There's a lot of different ways to apply that. But almost all of it is really suppressed. There's a lot of complexity around using stem cells. It's true in the UK, it's true in the US. But it can be fantastic medicine. One of the things that I really like about the idea of stem cells, and more broadly this category of regeneratives, is that they rely on the native wisdom of our own biology. It's not me trying to figure out all the intricacies on how to make someone's body work right. It's me thinking, okay, this person's body has wisdom and wants to heal, but something's in the way. Regenerative medicines as a general class is basically saying, hey, we trust this person's body can do this. You know, we know that our medicine is limited, the science is limited. Like, that's a really critical point, guys. Medicine used to be called a practice to remind doctors that we're practicing, we're always evolving, and that's kind of faded away for some god-awful reason. And so, if we can engage someone's body in its own healing, that's always a really, really good angle. Okay, back to the music.
My body got stronger and my stomach felt hunger for a door that was closed, and my soul heard music for the first time. Beauty was a word I'd use for this gift of gold. Oh Lord, I forgive you. Lord, I forgive you. Lord, I forgive you. Make me whole. This music I give you. Pain that I live through. Everything I've been through is yours to hold.
I love the sample. Reminds me of the old Moby track. The old school spirituals. Yeah, really spiritual topic, right? The nature of our suffering. Hang on, let's pause on this here. Conditions like Lyme disease, ME, MCAS, POTS, fibromyalgia, etc. all receive criminally low attention and funding relative to many conditions. Yeah, this is totally true. And these all fall into a category that I would describe as complex illnesses, complex medical illnesses. And I use that term really specifically. These are all illnesses that are multifactorial, and they have a big variance in how they affect a given individual. And so if we try to think of them simply and reduce them into a category, we are not going to understand them. Every single case of Lyme disease, of mast cell activation syndrome, POTS, fibromyalgia, all of these neurological degenerative disorders that I've treated successfully, it always comes from looking at that individual with all of their complexity, trying to think about the multiple factors that create this illness. A very straightforward example is that in Lyme disease, oftentimes advanced practitioners will think about complicated treatment mechanisms to suppress the Borrelia bug or the other Lyme vector illnesses. But it's complicated. You can't just do that, otherwise people get stuck on antibiotics the rest of their lives, for instance, or whatever herbal therapy you might be using. There's more going on there. There's a reason that individual's biology was vulnerable in the first place. You must fix that. These are good, but you have to come and meet it by restoring native function too. So, I totally agree. This is my bread and butter here, is how do we fix these problems for individuals? How do we increase education about this? So it's awesome to see a lyricist who's spinning up who's really cooking here, bringing attention to these. I love it. Yeah. It's cool. Heck yeah. It's awesome. That's cool. Yeah. Ren, hats off, man. It's so cool to see someone advocating with so much skill. It's just great. On my part, I'm always hopeful that doing free distribution of education like this YouTube channel is built for helps people. I hope that people see Ren's work. I hope that I can produce some things that are helpful to people as well. It's for people to be able to kind of get exposed to a different philosophy on this sort of stuff. Because I really, if anybody is down and they're lacking that hope, like Ren is saying there, go somewhere else. Doctors are not omnipotent and omniscient. They're just folks who went to school and learned a trade kit. And the really good ones are also healers and scientists. Try and find those people, advocate for yourself, pay attention to your own body. If a doctor says, oh no, that's not the case, what do they know? They're not in your body. They know some scientific things, but they've never studied you. You weren't in those studies that proved those things that doctor is crutching on. So we need more complexity, more individualization, more personalization in medicine broadly. And I know Ren's in the UK, but I know also their healthcare system has a lot of the same struggles that we do. We have to keep on pushing. I think a lot of medicine is stuck because it's met its profits incentives. right? Like the system works really well to make money for the people who are making money in this. Right? Like back in the day, even go back to the 1920s, like these scientist healers, they would make these innovations and they would release the patent for free. Like, where did that go? Like, why are we so stuck? And the system is really complicated. Like, part of the reason is that these physicians are in this insurance model where they can't think outside the box. They went to med school and they have a $250,000 loan, so they're like, man, I got to get a paycheck. The whole thing is just bananas. So, if you guys don't know this about me, you know, I'm all about the parallel. You know, build the parallel thing. Guys can do whatever they want in the regular system, and I'm going to let people vote with their minds and their wallets, and they can go get good medicine in a parallel system if they want it. I'm a parallelist. I think that that's just an intelligent way to push forward this whole stuck system. Let's just compete with it. Let's show people that there's a better way to do this. We don't have to denigrate them and put them down in the old system. You know, maybe there's some use in that, but I wish those guys well. I just want them to come up. I want to be inspiring to them, to MDs and DOs who are stuck in the system. I want to be inspiring to patients who need that, and I'm really inspired by Ren. So thank you, brother. Okay, guys, we'll catch you next time.